Well, welcome back to Hamilton Live, everyone. So how many times have you brushed your chompers? Depends on how old you are, obviously, but do you still, or do you know how to do it right, even though we've been told over and over again, Larissa? So this is really good, and this is going to lead up to a great event that's happening on the weekend that we'll talk about in just a second, but I first wanted to talk about how to properly brush your teeth.
Absolutely, and you're right. You know what? We do forget the proper technique, and there's so many different types of brushes, electric brushes, manual brushes. So we're going to demonstrate one technique here today, and then hopefully people can go home and give that a try.
And this is just with your typical toothbrush that
Yes.
everyone can have access
Regular
to.
manual toothbrush. Always remember that it should be a soft or extra soft toothbrush. A lot of people like to use a medium or hard toothbrush because they feel it cleans their teeth
I was just going to say that. You can feel the soft ones. I always feel like, is it doing anything?
So the problem is the hard brush actually does more damage than good because you're actually wearing away your gum surface, and it abrades the tooth surface a little bit as well. So that can lead to recession, tooth sensitivity. So everything you're brushing off your teeth is actually soft debris. Plaque is soft, so you only need a soft toothbrush. And as long as your technique is adequate, you will be removing everything that you need to remove.
Okay, and is there a technique in the mouth that you should go through so you don't miss anything?
The most important thing that we like to remind people of is the 2 and 2 concept. So 2 minutes twice a day. So breaking down, so breaking down the 2 minutes in the mouth is actually quite easy. We always recommend a pattern and a routine that you use. So if you look at the mouth here, we're going to do 30 seconds on the top outside, 30 seconds on the top inside, 30 seconds on the bottom outside, 30 seconds on the bottom inside.
Makes sense.
And then you'll never miss any area. And we do commonly see that. Clients will come in, patients will come in, and they've got a couple of areas that they always seem to miss, and they probably just don't have a good routine going.
Yeah, so that, I mean, that's nice and easy. One way back and then one way and back on the other side.
You got it.
When you're doing that, you should be counting, obviously, to keep kind of a track of it. Because I find if you don't, you think, oh, I've been brushing forever, and it really hasn't. Like, you'd be lucky if you've been brushing for a minute.
So a good thing to use is actually a song on the radio. If you've got either a radio in your bathroom or you can hear your radio from your bedroom, brush to the full length of one song, and that should give you your full 2 minutes.
Yeah, for sure. Okay, and then when you do brush your teeth, what's the proper way to do it?
So the good thing that you want here is you want your toothbrush at a 45-degree angle towards the gum line there. This is where the bacteria likes to live, where the gum meets the tooth. So put your brush at a 45-degree angle, do a little jiggle stroke that loosens up that plaque and bacteria, and then sweep down. That sweeps all the bacteria off. And then you're going to continue like that all the way around that arch. Careful around the corners. That's where some people end up missing. And you just go all the way around like that.
You kind of take a shortcut.
You have to change the way you're holding your brush sometimes. So anytime you have to do that, sometimes you miss. So along the gum line, jiggle and roll down, and then same thing on the inside, jiggle and roll down. Okay, all the way around. And then on the bottom, it's just the opposite. So you're going to tip your toothbrush towards the gum line 45 degrees. So on the top, this way, on the bottom, this way. Okay?
And a question is with flossing, because I think that's the one that a lot of us miss on, and that's where you end up having a lot of problems with your teeth, and I'm on my kids about it all the time. It's really hard to get them to floss. How often should we floss? Is it a daily practice?
So, and a really important fact to know is if you're only brushing and not flossing, you're actually only cleaning 66% of your tooth surface. So you're missing a whole third of your tooth surface. So the flossing is definitely really important because the brush doesn't get in between the teeth. See those contact areas where the teeth meet?
Right.
Your toothbrush doesn't get in there. So those are the areas that the floss has to get into. Otherwise, that's where people commonly will start cavities forming. So ideally, we would love to see flossing done once a day. It's very difficult for people to get into that habit. So even if you can do once or twice or 3 times a week, it's better than nothing.
Not at all. I mean, at least do it at some point because it is good. It is really good for you. When you do it on a regular basis, it's incredible the difference it makes. When you have to go in to have your teeth cleaned.
For sure.
It really cuts down on the amount of work that you guys have to do when someone comes in.
Absolutely. Yeah. And we know, we can see that gums in between the teeth will actually start bleeding more if you're not flossing in there. And then once you start flossing, the bleeding will actually subside. So we can tell what people are doing in between their dental appointments
no doubt. Now, what about the electric toothbrushes? Are those a good idea? Do they help it? Do people get lazy with them?
Actually, the electric toothbrushes are fantastic. The only thing to remember with them is they are rotating really quickly. So if you apply too much pressure with that electric toothbrush, you're getting too much strong action on that tooth.
Okay.
So don't push too hard with it, but other than that, they're excellent. You still want to guide them around exactly the way I showed you. Use that 2-minute system and routine, and you'll be doing a fantastic job.
Love it. You made it nice and easy. So hopefully we can all remember that, because I'm sure most of us are still not brushing our teeth correctly. I wanted to talk about Gift from the Heart, because that's happening this Saturday, February the 8th, and this is 5 years that the Ontario Dental Education Institute has been doing this. I think it's wonderful, a wonderful way to bring awareness, but also to give back to the community, because it's free.
It is free, and this is our 5th year doing this. It's a national event, and it's a one-day event the Saturday before Valentine's Day, and dental hygienists all across Canada open up their clinics and their hearts, and we provide free dental hygiene services to members of the public who have difficulty affording or accessing dental hygiene preventive care.
Which is really great. And thanks for doing that. And thanks for coming and giving us a demo too, because that'll help people as well. So don't forget, now it is a first come, first served basis. Gift from the Heart will be happening on Saturday, February the 8th from 9 until 1 p.m. 201 Wilson Street East in Ancaster is where you can go. You can call 905-304-4706, extension 201, or giftfromtheheart.ca is where you can go for more information. Keep in mind too that doing this, getting your teeth clean on a regular basis can reduce many issues when it comes to disease as well, which a lot of people don't know about. So yeah, thanks so much for coming in, Larissa.
You're welcome.
Great to have you.
My
Again,
pleasure.
Gifts from the Heart. Don't forget about it. Mark it on the calendar. All right, Kate.